हमारे फ्रंटलाइन हीरोज, डॉक्टर्स, नर्सेस और एडमिन के लोगों ने अपनी जान की बाजी लगाकर हॉस्पिटल में लोगों को बचा रहे हैं। लेकिन एक बार फिर वो हमारे सामने आए हैं हमसे अपील करने कि अगर आपको कोई और भी प्रॉब्लम है, प्लीज घर में डर के ना रहें, आप हॉस्पिटल आएं, हम आपकी सेवा के लिए हाजिर हैं। तो हमारे आज के मेहमान हैं डॉक्टर राजीव जौहर। Can you please tell us a little bit more about COVID-19 pandemic and lesson learned by Northwell Health?
We have seen over 14 to 15,000 COVID patients in our hospital. We've done a lot of the trials with remdesivir, with hydrochloroquine, and other medications with immunoglobulin. So we've been at the forefront of all the academic work with the COVID-19 pandemic. But from a heart perspective, we've seen a lot of pandemics in the last 400 years, all around the 20s, unfortunately, 17, 18, 19, and 2020. And we've seen, we've learned from each of these pandemics. We have learned from each of these pandemics. And what we have learned from this pandemic is that abnormal presentation is normal. So a patient who has a classic heart attack EKG has completely normal arteries to the heart and normal heart function, which is shocking to us. I was convinced this person would have a heart attack. And what we have seen with these people is a lot of them have what's called myocarditis, or infection of the heart, but not of the arteries. This patient, for example, had fluid around his heart that I removed. That's the fluid that I removed from his heart. And what that has led to is a concern and fear by patients to come to the hospital. So where have all the heart attacks gone? What we're seeing is a dramatic decrease in the number of heart attacks. Everyone, however, has become the expert in this situation. And what we have noticed is that normal is not normal. There's a clot in the right ventricle here. This is a lung exam showing a large clot into the lungs. And this is a gross picture, but this is the clot that we removed from the lungs of this one patient, which we don't see very regularly and routinely. One thing, this is a very numbing slide. I got this from the New York Fire Department, FDNY. If you look at the blue line, this is the number of deaths that the fire department sees every day normally. So about 30 times they get called to someone's house and the patient's dead. During the pandemic in 2020, there were days at the peak where they had 280 people die at home on a given day without ever coming to the ER. And why is that? Why is that? Well, because the number of procedures dramatically dropped. Look at our cath at North Shore and LIJ. We did about 1,100 caths in 2019, from March 16th to April 27th. In 2020, we did an 83% reduced procedure rate. Wow. And that was for everything. So people are having heart attacks and heart symptoms at home, and they're not coming to the hospital. And that's why my biggest thing is, because, people are afraid. This is our auditorium that was converted to a COVID floor. This is our short stay unit that was converted to a COVID floor. This is our hospital that we had in our parking lot that we used. This is our parking lot with a small hospital that we put our patients in because we had no beds. I'll give you an example. One of our hospitals has 585 beds. Well, that hospital had 930 patients at its peak. Wow. So you can imagine every corner of the hospital had these patients. And so we learned a lot from this COVID-19. We learned that we presume that everyone has COVID. We want to make sure that we don't cause a resurgence. We are using PPEs on every patient. We are using innovation, like this Zoom call with you, Neeta ji. It's very important for me and us that we communicate the importance of regular cardiac care. If you're having chest pain at home, don't be afraid to come to the hospital. You could be having a heart attack. You could be having a problem. It's very, very important you come back and you come into the ED and be evaluated. If you're not sure, please contact your doctor. They are doing telehealth visits. I did 10 this morning where I zoomed essentially into people's homes and talked to them to see how they were doing symptom-wise. There are things out in the market now, e-commerce, e-health, with EKGs and blood pressure and pulse and weight. Use them if you can, because it is very, very important that we not neglect other care of patients. And I understand you're scared. You know, I have been coming to the hospital now every day for the last 2 months, and I myself am afraid. But you know, you have to rest assured that the hospital is probably the safest place for you right now if you're having symptoms. And if you have fear of getting COVID, understand that we're very diligent in cleaning, in making sure that everyone has the appropriate face mask and gear to minimize your risk. Because we're creating COVID-free spaces. We want to make sure that the patient and staff are safe. Every patient who comes into the hospital and gets admitted gets a COVID test to make sure that they're either COVID positive or COVID negative. That will help us triage these patients. I use these N95 masks regularly, and we have an ample supply of them, so it's not a problem at all. It's important that you understand that the environment is safe to come to a hospital, and if you're having chest pain or shortness of breath and you're not sure what's going on, don't hesitate to come in. Our goal is to mitigate the second wave, so we want to do it in a very systematic, educated fashion. But the reality is that there's a lot of hope still. The recovery space that we lost to COVID, we got back last week. And so everything is starting to come back to normal. The governor yesterday approved elective procedures for cath, electrophysiology, echo, and all the other procedures we do, stress testing. So we're going to start ramping up the procedures. You have any fear, any questions, anything, please, please, please don't hesitate to call. Contact us anytime you want. We're happy to help. So Neeta ji, this is very important for me because what I've seen is a lot of my own friends who call me at night and say, I'm having chest pain. I tell them, let's go to the ER, and they adamantly refuse. I want people in the community to know, especially South Asians, that if you have a risk factor of hypertension, if you're obese, if you have heart disease, if you have heart failure, if you have a sedentary lifestyle, it is very, very important that if you have any symptoms that you're not sure what they are, that you get yourself to an urgent care, you get a telemedicine visit with your doctor, or you contact an emergency room. There's 2 types of heart attacks. So there's a blockage heart attack and a heart attack because your heart rate is very, very high and you're not getting enough oxygen. The heart attacks that are because of a blockage, they have not changed. That's the same number. The problem is, those patients are not coming to the hospital and being treated early. So their heart function is worse. They're having more symptoms. They're having more heart failure. They're having more irregular heartbeats. That's the problem. So we need to get those people to understand कि बहुत ज़रूरी है कि वो अस्पताल आएं if they have symptoms.
Very, very, very interesting, Dr. Jauhar. You have put a lot of work, a lot of efforts to prepare this presentation. A lot of research has gone behind that. And as I said, the South Asian market की community की research आप continuously करते रहते हैं.